Live around New Jersey, around the clock. This is News 12 New Jersey.
All right, as we know, summer is a really fun time for kids, but it's also a dangerous time. So let's talk about keeping our kids safe this afternoon. Joining us by phone is Dr. Sasha Baldeo, an emergency medicine doctor at St. Peter's University Hospital in New Brunswick. Hi, Dr. Baldeo. Thanks for being with us.
No problem.
All right, so we know the kids want to go outside. I mean, my kids were nagging me all morning. Let's go outside. Let's go outside. But it's so easy for their skin to get burned. So let's talk about what we need to remember when it comes to sunburns.
Okay, well, first off, this goes for kids and adults. Prevention is key, so you want to make sure that the kids have a nice coat of sunblock on. That's very important. Keep them covered either with a hat. If you're going to be out for an extended period of time, maybe an umbrella might help. And hydrate beforehand. So it's very easy to recognize the symptoms after: excessive sweating, evidence of sunburn where the kid's skin becomes very red and irritated. So prevention's actually the key. If you can keep the kids hydrated 2 to 4 ounces every 15 minutes or so before starting an outdoor activity, that would help a lot. And try to avoid caffeinated beverages. So soda, not so much tea and coffee for kids, but in general, would be a good start.
Right. Now, what about the really young ones who can't tell you? I have a 12-month-old at home, and, I'm always concerned, is she drinking enough water? I mean, how much is enough for, the littlest ones?
Well, you want to monitor urine output. So you want to, if it's a young child, you want to make sure they have about 2 wet diapers an hour, and that the urine is looking very clear, very similar to the color of water. If you find that it's looking very dark, very concentrated, this could be a sign of dehydration.
Okay, now let's talk about those simple tips when we're going outside with our kids. What are some things that you want us to remember and to bring with us?
So we mentioned before sunscreen. You want to make sure that the kids are comfortably dressed, so that would include loose-fitting clothing, lightweight clothing, light-colored clothing is actually very helpful, and a hat or some sort of umbrella to keep them shaded, and snacks. A part of it is hydration. The other part is salt and the loss of electrolytes. So some handy snacks would be helpful as well.
It is so important. All right, Dr. Sasha Baldeo, an emergency medicine doctor at St. Peter's University Hospital in New Brunswick. It's such important information. We could probably talk to you all afternoon. There's so many tips that we could give parents on this topic. I want to thank you for sharing some of those with us this afternoon.
My pleasure.
Take care.